One of my favorite people joining us live right now, my good friend Dr. Joe Congini from Akron Children's Hospital Sports Medicine Center. Good morning, Joe.
Hey, Ray. How you doing this week?
I'm doing very well. You as well, I hope. And I guess where do you want to start this week?
Well, one of the things that's been kind of interesting is the with the COVID changes in professional football and college, it's really played havoc with the schedules, especially in college. But in the pros, it's kind of worked out that there's been kind of some bonus games for people to be able to watch, extra games during the course of the week. And it seems to me, I don't know, a lot of people were asking me yesterday about a game that Cleveland fans, our Northeast Ohio fans, had a lot of interest in, was the Pittsburgh Steelers game against Washington. And there were a couple of foot and ankle injuries that I wanted to talk about. Which one's worse? What are these common injuries? And I kind of wanted to explain two injuries to you. I call it a tale of two ankle injuries. And I'll get you involved, and I know you know your sports injuries pretty well as to which one's kind of a worse problem. Early in the game, I think on the very first carry, a very good running back for Washington by the name of Antonio Gibson went down and limped off the field and couldn't bear weight, and there's talk that he may not be ready for several weeks now. He just could not bear weight and push off, and from what I'm hearing is it sounds like this may be a case of turf toe. And turf toe is an injury that's been around for a long time and been discussed for a long time. Historically, living through it, I think it really started and was at its worst in the very early days of artificial turf. The first generation turf was really just kind of cement laid down and kind of indoor-outdoor carpeting, kind of a thin covering on top of our indoor-outdoor turf. And as athletes would push off very hard against that very hard surface, they would hyperextend their toe. And there's still situations where athletes get pulled backwards or twisted in a pile, and they will hyperextend the toe and develop a problem called turf toe. And what turf toe is, Ray, it's a ligament sprain. And the sprain in the great toe, the biggest joint of the big toe, is a very tough, strong ligament on the bottom of the toe. But what happens, like any other ligament injury that we have, athletes sprain this ligament. And like most other injuries that you and I talk about a lot, it's always a matter of what's the extent of the injury. How bad is it? So some people just stretch that ligament and it bothers them and they tape it up and they return to the same game. And others get a partial tear and they wear these inserts, or we call it a steel shank in the shoe, so they can push off, and they're taped in different ways, and there's different types of braces to wear to support that ligament, but they kind of limp around and still struggle. And then there's grade 3s where people completely tear that ligament. It doesn't heal well. Many times that's on kind of the second or third time. They don't let it heal the first time, and it gets worse and worse, and they get a complete tear, and they just can't play. They can't push off, can't play at all, and it ends up being the need of a surgery to operate and fix that ligament. And it's often as long as 6 to 12 months to heal that ligament when people tear that ligament with turf toe. Of course, being a veteran sport fan like you are, you remember probably the most famous person, and also, I guess, since we're talking Pittsburgh Steelers, a Pittsburgh Steeler who had turf toe.
Yeah, as a matter of fact, two names came to mind while you were describing that. I think the person you're talking about, Joe, is Jack Lambert. The other one that comes to mind right away is Deion Sanders with me, and I think that ended the career for both of those players.
Both of those players never were able to return back to the level they were at. Unfortunately for Lambert, he was even older, so we didn't have the really good procedures about how to fix it. And so Lambert, of course, we always love to talk about when it's local people. He was probably one of the top 5 linebackers of all time, and really the linchpin of that great Steeler team. And he was from Manaway, Ohio, right? He went to Crestwood High School. Yeah. He went to Kent State University, and one of the great linebackers, 12 years or so, turf toe, couldn't get it fixed, couldn't get back on the field. I looked him up. Jack Lambert is still 68 years of age. He lives on a big long farm in Wilmington, Pennsylvania, I believe, and he's an intensely private guy, 68 years of age, but he's still alive and kicking. But he's the guy who is most associated with turf toe injury, as well as Deion Sanders. Good job, as usual. The other injury in the tale of two ankle injuries is happened the other day is a guy by the name of Alex Smith, the quarterback. He had a pretty good game, I think, for Washington. But at one point they showed all this blood in his shoe and blood on his sock. I don't know if you got to see that game, but it really unnerved a lot of people to see that. And yet this is a very common injury that occurs both in your sport with baseball and in soccer and in football. In fact, soccer might be the most common, is where the bottom of a stiff bottom cleat of a shoe will drag right across the shin bone or the tibia bone and actually get a pretty deep laceration or cut. But worse than that, it begins to kind of tear some of the covering of the bone, which is known as the periosteum, which has a lot of blood vessels and nerve endings in it. And so these things will bleed a fair bit. These things will be somewhat painful, but they're not a structural thing, so people can play with them. So they fairly quickly cleaned up the blood on Alex Smith's ankle. I think he barely missed a play. They taped it back up. The key is you want to keep the blood out of these. If the blood stays in that place, it's called a tibial hematoma. These people can develop a hard bump there that they have really for the rest of their life. So this tibial hematoma, better known as getting cleated, is the term that athletes talk about it, where that cleat tears against the lining of the bone. And again, a lot of our soccer players, that's why they wear shin guards in a lot of situations, but it happens a lot in football as well. And it was unnerving to people to see all that blood with Alex Smith's ankle, but it really is a much less significant injury than the turf toe that Antonio Gibson had early in the game. So two kind of common injuries that I wanted to just touch on that occurred in the same game for people to understand the difference with turf toe and being cleated, or tibial hematoma.
Joe, you mentioned Jack Lambert. I believe in that rural setting in Pennsylvania, he serves maybe he has since retired, but he served as a game warden. He would walk around the woods and, check on the hunters and make sure they're following protocol and stuff. And I saw an interview with him one time. He said he just loves walking around the woods and he gets paid for it, so he was in heaven.
You're an amazing guy, Ray. That's exactly what I just read about a 250-acre farm, and he is a warden there as of last. But now it's 68. But he's apparently doing well, but was an amazing football player, and his name will always in the sports medicine annals be associated with ending his career because of turf toe.